Well, good afternoon. The ISMA is happy to provide today's webinar on navigating the 2023 Medicare enrollment. I'm Tom Martins, the Director of Insurance at Indiana State Medical Association, and joining me is Donna Mallinckrodt, ISMA's Medicare Specialist, who has committed herself to educating and assisting ISMA members and their spouses about ISMA health insurance, especially those who are or will soon be on Medicare. Please note CME is not being offered for this webinar. This webinar is being recorded and will be available on the ISMA Insurance Agency website. The slides from this presentation will be saved as a PDF file, and please let us know if you'd like a copy, and we'll be happy to email one to you. This presentation contains basic Medicare information. It is not a substitute for supplemental plan materials, materials provided by Medicare, or materials provided by an employer. This presentation should not be the only source of your Medicare education. If you have any questions during the webinar, please submit them through the Q&A button, which is located at the bottom of the screen, and we will address questions at the end of the presentation. With that, let's get started. As physicians and spouses approach age 65 throughout the year, and especially during the Medicare open enrollment period that we're in right now, we received quite a few calls with questions about Medicare, Medicare supplemental coverage, and Medicare drug plans. We appreciate you joining us today and hope you'll walk away with some helpful information. All right. Interesting factoid. Medicare was started in 1965 by President Lyndon B. Johnson. Donna, what else can you tell us about Medicare?
Sure. So Medicare is a federal health insurance program that helps with the cost of health care for individuals 65 and older. The Centers for Medicare and Medicaid Services manages Medicare. So after enrollment, they'll send you a Welcome to Medicare packet and a Medicare ID card. You'll also receive a Medicare and You handbook with important information about Medicare coverage choices.
Gotcha. And now, who is eligible for Medicare and when do they become eligible?
Sure, good question. There's three types of individuals that qualify for Medicare. The first are individuals turning age 65. Then there's individuals who work after the age of 65 who were previously covered under a large group employer health plan. And the third group are individuals under age 65 who qualify for Social Security disability.
Very good. And next, can you give us a quick overview of the different parts of Medicare?
Yep, sure thing. So Part A covers Medicare care in the hospital and skilled nursing care following a hospital 3-day stay. Part B is referred to as medical insurance and covers things like doctor services, outpatient care, ambulance services, chemotherapy, and some diabetic supplies. Part B pays about 80% of eligible claims. Part C is known as a Medicare Advantage plan, and that's sometimes called an all-in-one alternative to original Medicare. These bundle plans include Part A, Part B, and usually Part D. Subscribers stay within an HMO or PPO network, and most plans offer some extra benefits like vision, hearing, and dental. Part D is a prescription drug plan offered by an insurance company. Part D plans are most often paired with original Medicare and a Medicare supplement plan.
And I find it helpful to keep in mind that Medicare Part A and Medicare Part B are provided by the federal government. They're sometimes referred to as sort of like a couple, like salt and pepper, as original Medicare. On the other hand, and on the other hand, Medicare Part C and D plans are offered by insurance companies rather than the federal government.
Correct.
So when it's the right time for an individual to apply for Medicare, how do they go about doing that?
Sure. So most people like to apply online at www.ssa.gov /benefits/Medicare. If you scroll down about halfway down the page, you'll see a blue tab that says to apply for Medicare only. Some people like to make a phone call and have a representative enroll them, and that phone number is 1-800-772-1213. And then sometimes the local Social Security offices are starting to open up again, so you can apply in person. And you might want to call Social Security number first to make an appointment. And you can make an appointment directly at the 772-1213 phone number. For individuals who have not worked 40 quarters or 10 years and they want to apply for Part A benefits under a spouse's work record, they'll need to apply by telephone or in person at their local Social Security office. And I can recently tell you from experience that if you do go to a Social Security office, it's a good idea to go just before it opens. It opens at 9 in the morning. If you get there at about 8:45, there may be a small line, but you'll be out of there by 9:15.
Ah, that's good advice. That reminds me of the BMV.
Yes, exactly.
Yeah. All right. So we just talked about how to enroll in Medicare. Now let's look at some specific situations. So the first would be applying at age 65. A physician typically applies for Medicare at age 65 when they're in one of three situations. First, they're retired, or second, they're still working and they receive health insurance from an employer with fewer than 20 employees, or third, they're still working, but they buy private individual health insurance and don't get it through an employer. So, when does a physician in any of these three situations enroll in Medicare?
So the initial enrollment period lasts for 7 months. It begins 3 months before the month they turned 65. It includes the month of their birthday, and it ends 3 months thereafter. Coverage begins the first day of the month that the subscriber turns 65. So if someone's birthday is on November 17th, Medicare will actually begin on November 1st. However, if the birthday is on the first day of the month, then coverage will begin on the first day of the prior month. So if a birthday is on November 1st, then coverage begins on October 1st.
Okay. And I understand that if an individual is already enrolled in Social Security, they'll automatically receive their red, white, and blue Medicare ID card in the mail about 12 weeks before their 65th birthday.
Correct.
All right. The other very common situation we see is a physician who is still working at age 65 who receives health insurance from a large employer. That is an employer that has 20 or more full-time employees. When a physician in this situation reaches age 65, they have two options. The first option is to continue their employer-provided health insurance, which will continue to cover them exactly like it did before they turned 65, or they can waive coverage through the employer, start Medicare as their primary insurance, and then purchase Medicare supplemental coverage. So, what are some things for physicians in this situation to consider as they decide on one of those two options?
Sure, good question. So if they plan to continue to work, they should probably perform a cost-benefit analysis. Compare the employee health insurance contribution, and that means what you'll actually pay for health insurance and benefits, to what you'll actually pay for Medicare and benefits. And don't forget to include the annual deductible in your analysis. There's a big difference between a $5,000 deductible and a $226 deductible. And sometimes if there's a spouse or children currently on a group health plan, it's easier just to stay with the employer. And you might find out that signing up for Medicare at 65 makes the most sense financially.
Mhm. Okay, that's good advice. So, for a physician who decides to continue health insurance provided by a large employer after they turn 65, how do they enroll in Medicare when they retire?
Yep. So when a physician and spouse retires after the age of 65, they'll enter an 8-month Medicare special enrollment period. Within 4 months of the retirement date, they can contact Social Security to start the enrollment process. So for those physicians that are retiring at the end of the year, let's say 12/31, they can actually start the enrollment process anytime in the fall. And it does take some time and several weeks to get everything in place. So my recommendation is that they start sooner rather than later. And one other factoid that I discovered on my own is that Social Security or applying for Medicare Part B does not consider COBRA to be creditable coverage. And so what that means is because you have this 8-month enrollment period, if you lose employer coverage and you wait more than 8 months to apply for Medicare, you'll have to wait for the next open enrollment period.
Hmm.
And so what Medicare will do is as long as it's within that 8-month period and you have COBRA, they'll still enroll you when COBRA terminates, but they don't take COBRA into consideration when determining the enrollment.
Oh, that's interesting. So it seems then that it would make, the most sense for somebody who retires to not go on COBRA, but just start Medicare at the time that they retire.
Absolutely. Yep. You're absolutely correct about that.
All right. Um, okay. So, yeah, over the years, we've learned that there are a few important things that individuals who have a health savings account should know when they become eligible for Medicare.
Yep. So an individual with a health savings account who continues to work for an employer after age 65 can continue to make pre-tax contributions as long as they don't enroll in Part A, Part B, or Social Security benefits. HSA funds can be used to pay for eligible medical expenses and Medicare Part B and D premiums and a Medicare Advantage premium, but they may not be used to pay for a Medicare supplement plan.
Okay, that's good to know. And then just to reiterate, going back to that first bullet, when an individual continues to work for a large employer after turning 65, although they have the option to start Medicare Part A at no cost when they turn 65, and it would serve as secondary insurance for them. If they have a health savings account and they want to continue to make HSA contributions, then they need to wait until they retire before they start Medicare Part A.
Yeah, absolutely.
Okay. And there's one more thing that's good to know for individuals who retire from a large employer after age 65, especially if they have a health savings account. And what can you tell us about that?
Yep. So if they retire after age 65, Part A coverage starts 6 months back from when they sign up or apply for benefits from Social Security. So here's an example. If they determine their retirement date to be July 1st and apply for Part B starting July 1st, Part A is actually going to start 6 months before January 1. Rather 6 months on January 1. So if they have an HSA, they'll want to stop contributing 6 months before applying for Medicare or Social Security benefits.
Okay, that one's a little tricky. So yeah, I think it's important for people to keep that in mind. All right. So when a physician is ready to start Medicare and some kind of supplemental coverage, what are the two main approaches or options?
Yep, so there's two types of Medicare coverage. The first is known as Original Medicare, and that includes Part A and Part B insurance. Most subscribers will purchase a Medicare supplement, like the ISMA Medicare supplement, to help pay out-of-pocket cost. About 70% of subscribers also enroll in a separate prescription drug plan. Now, a Medicare Advantage plan is an all-in-one alternative to Original Medicare and is administered by a Medicare-approved insurance company. These bundled plans include Part A, Part B, and usually Part D. And most plans offer some extra benefits like vision, hearing, and dental.
Okay. Let's kind of dig into those a little bit. The first option that you just described involves Original Medicare. Again, that's Part A and B, sort of like salt and pepper, plus a Medicare supplement like the ISMA-sponsored Anthem Medicare supplement and a Medicare Part D drug plan. You want to talk some more about the ISMA-sponsored Anthem Medicare supplement?
Yeah, sure thing. So the ISMA Medicare supplement is a high quality, affordable health plan designed just for ISMA members and their spouses. Medicare covers about 80% of claims, and the ISMA MedSup is desired to pick up the other 20% of eligible expenses, such as deductibles, copays, and coinsurance. ISMA currently offers a first-year discount for members who are new to Medicare, and we added a second and third-year discount as well. With the discount, subscribers at age 65 will pay a premium of $120 per month and a Part B deductible of $226 per year. There are no referrals for specialists, and one of the best things about our plan is that subscribers can go to any physician in any state as long as the provider accepts Medicare assignment. So if you retire and move to Florida or the Southwest or anywhere else, you can keep your Medicare supplement plan, and as long as your doctor accepts Medicare, you'll be good to go.
Yeah. And we do have ISMA members all over the country who have this policy.
Correct.
Yeah. We've really tried hard, especially over the past 5 years or so, to make some tweaks to this plan to make it a sort of a flagship product for ISMA members. So do you want to talk a little bit about some of the things that make this plan unique?
Yeah, so one of the improvements we made in our plan is Silver Sneakers Health Club membership. And that doesn't mean that you have to go and you have to do chair aerobics or sit with the other Silver Sneakers members. You can just go and use that to walk into your health club free of charge. And I know that that's a great bargain because my health club right now is costing $54 a month. So the other improvement that we have are travel services outside the U.S. Most Medigap plans have a maximum lifetime benefit of $50,000, and the ISMA plan does not have a maximum lifetime benefit. And then new in 2022, we added a vision benefit. So Anthem Blue View Vision includes an annual exam with a $5 copay, $130 allowance for frames, lenses with a $20 copay, with discounts for upgrades and add-ons. We also have discounts for an additional pair of glasses and $130 contact allowance. And it's easy to search for Blue View Vision providers at anthem.com.
Mm-hmm. Yeah. All right. And we don't have a slide on this, but I thought I would just mention that we also offer a separate optional dental plan for Medicare supplement subscribers. And for 2023, we, without making any change to the premium, we made a few changes to the dental plan, a few enhancements, including raising the annual maximum benefit from $1,500 to $2,500, adding as a benefit coverage for implants, dental implants. Those are now covered at 50% up to that annual maximum. And then there was a 1-year waiting period for major dental, and that waiting period has been removed. So for Medicare supplement subscribers, that optional dental plan, I think, will be much more attractive. All right. So the second option that you described earlier was a Medicare Advantage plan. And lately, I've seen a variety of celebrities who are older than 65 who are talking up those plans in TV advertisements. They seem to cover a lot of services at a low cost. So, what's the catch?
Yeah, so Advantage plans are sometimes referred to pay-as-you-go plans. And what that means is the more that you see a provider, the more you're going to pay. So each time you say provider, you could have copays for medical services. You may be required to use a limited network of HMO or PPO providers, and you'll most likely have a deductible for a hospital stay. You'll most likely need referrals to see specialists or prior authorizations for hospitalizations and tests. And most plans have an out-of-pocket maximum, which could be thousands of dollars. It's very important to note that the plan can choose not to cover the cost of services that the insurance company doesn't consider to be medically necessary.
Mhm. Yeah, so there's some significant differences there between a Medicare supplement and a Medicare Advantage plan. And we just want to make sure that people are smart shoppers and keep those differences in mind. Going back to the ISMA Medicare supplement, you pay the monthly premium plus potentially a $226 annual deductible. And then between Medicare and the supplement, you know that all eligible expenses are going to be paid in full. So your total healthcare costs are very predictable in contrast to a Medicare Advantage plan. For a physician who considers options and decides to apply for the ISMA-sponsored Anthem Medicare supplement, how do they do that?
Sure. So for our current members and spouses that are insured through the ISMA individual plan, they're automatically transitioned to the MedSup plan when they turn age 65. They'll receive an ISMA information packet 3 months before their birthday, reminding them to enroll in Medicare and how to do so. And ISMA members who are not insured currently through the ISMA just need to complete a simple enrollment form.
Yes, and that plan is guaranteed issue.
It
So
is guaranteed. Yeah, correct. So no medical information is required.
right. Yep. All right. Something physicians should know about ahead of time is the income related monthly adjustment amount, or IRMA. What can you tell us about that?
Ugh. This does not get a rave review, but so the income related monthly adjustment amount, it means that higher income earners will pay more for Medicare Part B and D. So IRMA is based on the adjusted gross income reported on an IRS tax return from 2 years before the year that they start paying IRMA. So in 2023, they'll go back and they will look at your tax returns from 2021. So be sure to check out our frequently asked questions Medicare document. It's in the 3-month packet regarding IRMA amounts according to income level. And you can find that document on ismaia.com. And if you just go right to the Medicare supplement page, you'll find it there.
Mhm.
So IRMA, again, specifically applies to Part B and Part D.
Yeah. And you just mentioned a 3-month packet. And so I thought I would just point out that for current individual plan subscribers and physicians who are insured through the Medical Practice Consortium employer group plan that ISMA Insurance Agency supports with customer service, we do send out packets to them 9 months before they turn 65, and then another one 3 months before they turn 65, just to remind them that that change is coming up, and basically provide them with information that they need to consider to get prepared for that. So you just mentioned that the IRMA is based on an individual's adjusted gross income from 2 years prior. If a physician who starts Medicare experiences a substantial reduction in their income, for example, if they retire shortly after they start Medicare, is there a way for them to request a reassessment of their IRMA?
Yeah, there is a way. There's a form out called the SSA 44. It's known as the Life Changing Event Form. It's a simple form to complete, and basically you complete the form and get that back to Social Security. I think they may have a fax number on the form, and it will take Social Security several months. I've been told as long as 6 months to actually review the form, but an adjustment will be made eventually to your IRMA. And additionally, it's important to note that um, when your income goes down and it's recorded through your income tax returns, then eventually IRMA will come down. So IRMA is not going to last forever. And so if someone is working at age 65 and they're still, fairly high income, at 70, if they're completely retired and they haven't worked, and I believe the figure is in 2023, if they make under $190,000 per year, then they'll pay what 95% of the population pays, which next year I believe is going to be about $168 per month for Medicare Part B. So it doesn't last forever. It does go away.
Yeah. All right. We talked earlier about Medicare Part D drug plans. There's really more than one reason to consider buying a Part D plan, right?
Yeah, there sure are. So original Medicare and Medicare supplement plans do not include prescription drug coverage. So there's if someone decides to delay enrollment, in other words, they're up in a pretty high income bracket and they decide, well, why should I pay an additional $70 a month when I don't take any drugs? So I'm just not going to enroll in Part D to avoid IRMA. Then they'll have to pay a late enrollment penalty later on down the road when they decide to enroll. So if they enroll after the age of 65 because they're still working, they'll receive a questionnaire from the insurance company that needs to be filled out and returned to confirm the prior creditable RX coverage through the group health plan. So if you miss that letter and fail to send it back, you may get charged a penalty. And once you get charged that penalty, it's very hard to get rid of. So this would actually apply to anyone that is still working, and check your mail carefully. There's going to be a lot of mail going back and forth, and make sure that if you get that questionnaire, you get it right back in the mail, and hopefully that'll take care of the possible penalty that they could charge you with.
Okay. And so again, that's really for people who work after they turn 65 for a large employer and then they retire.
Correct.
Okay. All right. Individuals can buy or change their drug plan during the Medicare open enrollment period, and that runs from October 15th through December 7th. So we're in that right now. Why is it important to use the online Medicare Plan Finder tool during each Medicare open enrollment period to select a plan for the following year?
Sure. So insurance companies move drugs on and off formulary and change tier level assignments, which directly impacts what they're going to pay at the pharmacy. And just because a plan covered medications one year doesn't mean that they're going to cover them the next year. The plans vary enormously in copays that they charge. And the most effective way to make a comparison is to use the online tool on Medicare's website. The Medicare Plan Finder is easy to use, and it automatically recommends the lowest cost plan that will cover your medication in the coming year. And I've just recorded a video on how to use the Medicare Plan Finder, and you can find the video at ismaia.com/videos.
Yeah, and that's a really helpful tool. You can start the video, catch up in the Medicare website. Basically, just follow what Donna is doing, and she walks you through it step by step, and just makes it easy to use that tool to find what's going to be the best plan for you for 2023. Okay, while ISMA members and spouses are really our customers, and we spend most of our time helping them with their own policies, occasionally we receive calls from folks who are trying to help a parent or maybe another family member. What advice do you have for them?
So if the family member has limited income, the state may help pay their Medicare premiums, or they may qualify for extra help to pay for some Part D drug coverage. Explain the difference, including the cost, between original Medicare and a Medicare Advantage plan. If original Medicare is preferred, discuss drug coverage and explain Medicare coverage options. And if a Advantage plan is preferred, research the PPO and HMO options to determine if any networks include the family member's current physicians.
All right. So for more information on Medicare, or if you have trouble sleeping at night, we put together a series of videos that are available at ismaia.com/videos, and we encourage you to take a look. One of those videos is the one we just mentioned, which is how to use the Medicare Plan Finder tool. So with that, we are ready to answer questions. And so let me just check the Q&A box here. Looks like we have one. What is the supplement fee if you're over age 65?
Yeah, so it's actually an age-based fee, and depending on your age, which would be important to know, it's hard for me to tell you exactly what the premium would be. However, if you don't mind sending me an email and include your date of birth, I'll be happy to provide that information. In general, the Medicare premium goes up by a few dollars every year. And by a few dollars, I might mean $5 or $6. So in other words, it's not going to go up by 20% per year or 15%. It just kind of gradually works its way up. And again, I would need to have a specific age to determine what the premium would be.
Yeah, so this individual is 79. I know that I can remember that at age 65, the initial premium is with the $15 per month discount that you get when you start the policy. It starts at $120. And I think that at age 80, if I'm remembering right, that it tops off at, is it $212.50 maybe? Not sure, but I can follow up with this physician and confirm that with him.
Sure.
I think it's $212.50. That's once you reach age 80, that's where it caps off. But I will get back to you to that physician with that particular information. Somebody else has asked about what is Medicare Part C?
Yes, Medicare Part C. So we're all watching a little bit of TV, and they're all over the ads and touting how wonderful Advantage plans are. So it's known as an Advantage plan, and the most important difference between Part C, which is the Advantage plan, and a Medicare supplement is the fact that the insurance company determines what is medically eligible and not Medicare. So here's this is just an example. This happened in the beginning of the summer or in late spring. I had a subscriber call me. It was a spouse of a physician, and the spouse decided to go on the Part C Advantage plan, and the physician took the ISMA Medicare supplement plan. And the spouse called and she wanted to know if she could come on to the Med Sup during open enrollment at the end of the year. And I assured her that she could. And she proceeded to tell me about a story where she had cataract surgery. And it was turned down from her Advantage plan because the underwriting at the Advantage plan didn't feel that her vision was bad enough to warrant new lens replacements. And so she ended up paying for the entire surgery, several $1,000s. And that was the reason she wanted to come on to the ISMA Med Sup. And so the difference is you have to be very careful with an Advantage plan because the insurance company, they they determine what is necessary and what's going to be covered and what's not. Another complaint that I've heard from more than one physician is that the Advantage plans, they basically determine how long a person can stay in a skilled nursing facility. And so if someone has fallen or needs skilled nursing care and the physician says, okay, well, we have, we found a skilled nursing facility for 4 weeks for you. The Advantage plan has been known to come in and say, no, we're not going to keep them in there for 4 weeks. They have exactly, 14 days or 2 days, or rather, however many days they determine is medically necessary. And so there's been a lot of controversy about them. And, and so again, it is known as a pay as you go. Initially, you look at the $0 premium and they're, going to do so many things for subscribers, and they seem to fall short on occasion. So just be very careful if you're going to enroll in a Medicare Advantage plan.
Mhm. Yeah, good. Another question was, really just a request to talk some more about the dental plan. And so the dental plan that I referred to is offered just to physicians and spouses who purchase the ISMA ISMA sponsored Medicare supplement, which is through Anthem. The dental plan that is optional is also through Anthem. It covers routine services at 100%. So your cleanings, your checkups, as long as you go to a network provider. If you don't go to a network provider, still covered, but you'll have a $50 deductible, and then Anthem will pay 80% for those routine services. For things like very common things like crowns and fillings are covered at 80%. Crowns are covered at 50%. And now, starting January 1st, 2023, dental implants will also be covered at 50%. There is an annual maximum benefit of currently $1,500, but that's going up to $2,500 on January 1st. And the cost for the optional dental plan is $40 per month per person. Anything else, Donna, that you can think of that I missed there on the dental?
No, I think that was a good summation of the dental plan.
Okay. Let's see, what else? Yeah, so really, somebody else just asked about kind of comparing the Medicare Advantage plan with the ISMA Medicare supplement. And you just talked really about some of the potential downsides of the Medicare Advantage or the Medicare Part C plans, and I'd say the key, or one of the key benefits of the ISMA Medicare supplement in comparison with the Medicare Advantage plan, again, would be the predictability of the cost. You're just going to pay your monthly premium and potentially an annual deductible of $226. And you know that between Medicare and the supplement, the rest of your charges will be covered. And so, again, it's going to be a very predictable cost. Whereas if you have a Medicare Advantage plan, it's going to largely depend on what services you utilize during the year. Does Anthem have an Advantage plan to compare? I believe that Anthem does offer a Medicare Advantage plan, Donna.
They do. I believe it's called the MediBlue, MEDIBBLU. And you can get information on that just by going to anthem.com, Medicare, and then there's information on the MediBlue.
Okay. Another question, do I sign up for Part A and B through the government? And if so, what is the website? And then how do I go about signing up for the ISMA Medicare supplement plus dental?
Sure. So you do sign up for Medicare through Social Security. So the website is ssa.gov, and I believe it was / retirement. Was it Medicare? Well, that was in one of our very first slides, but if you even just went to ssa.gov, when you open the page, you'll see a Medicare photo of a couple on the right-hand corner. Just click on that photo and scroll about halfway down, and you'll find a little blue bar that says enroll in Medicare only. And that's for those subscribers that are not enrolling in Social Security. And what was the second part of the question, Tom?
Yeah, and then the second part was how to apply for the ISMA sponsored Medicare supplement and dental.
Sure, that's a pretty easy process. If you don't mind sending me or Tom an email, we can get you started with that. There's a very simple enrollment form to complete. And I should also note that you do have to have Medicare Part A and Part B to have the Medicare supplement. And so you can't just be enrolled in Part A, it has to be Part A and B. But if you're enrolled in A and B, then you can complete a simple application form, and you can, essentially start on the first day of January 2023. But there is an application form.
All right, great. I believe that is it. And so we want to thank you all for participating in today's webinar. Transitioning to Medicare can be confusing and difficult, but we hope that today's discussion will make it easier for those of you who haven't done that yet. And we hope that the information about choosing a Medicare Part D drug plan was helpful for some of you. Hopefully everyone was able to learn something new today. If you have any questions down the road, please feel free to reach out to us. Here are our emails. And just let us know, if you want a copy of the PowerPoint slides, and we'll be happy to email those to you. Thank you very much.